how many of you have considered a career in surgery before? Let's get some answers in. Hi,
Hello, good
Dimitrios.
afternoon.
Hi, how are you
Hello,
doing?
good afternoon. Good afternoon, everyone. Thank you for
Good
coming.
to see you. Good to hear you. So we're just doing a poll right now. 70%, Dimitrios, had thought about a career in surgery before today. 30% hadn't. So you've got an audience that I think is waiting to listen to this talk. Brilliant.
Hello, everyone. Good afternoon. Thank you for joining us today. My name is Dimitrios Spinos. I am one of the core surgical trainees in East Midlands, and I will try to talk about my experience so far in surgery and what made me start doing surgery, and most importantly, what are the steps in order to apply for surgery. To begin with, I am an IMG, as all of you, most of you probably, and I was born and raised in Greece. I studied in the National and Kapodistrian University of Athens. I graduated in 2017, and after my mandatory army duties and masters in applied neuroanatomy, I moved to the UK. I started my F2 in Isle of Wight using the widened access to specialty training scheme, which was unfortunately stopped due to COVID, but I think is resuming, and it's a very IMG friendly scheme. And if it still carries on running, I strongly recommend it to anyone thinking of starting their career in UK. My FT was pure medicine, so I had a little bit of emergency department. I had MAU and I had cardiology. Obviously, most of it became COVID after a period of time, but the TLDR is that I didn't have any surgical job at all. So just to make sure that everyone is on board in this, there is no pre-requirement for surgical experience in order to start core surgical training. And if there is anything that training in the UK has been highlighting throughout the whole training process, is that they prefer the trainees to be malleable and inexperienced, so that they learn the way they want to teach us rather than have previous experience and have embedded ideas about how things need to be done, which might not be the same way as it is in our home countries. One thing that I want to clarify is that a lot of people used to want to do surgery, and moving in the UK, they change their career paths either because of lifestyle, because surgery has quite tough lifestyle, but also because of the second round recruitment. Since last year, this doesn't apply. So if anyone is motivated to actually do surgery, this is probably the best time to apply for it. So without further ado, let's do further. The structure of the interview, I will go through the traditional structure because obviously, again, due to COVID-19 pandemic, the interviews are being held electronically as via Teams, I believe is the plan. But once they resume the face-to-face interviews, the structure that I will talk you through is the one that they used to be run on, and probably the one that they will be still run on. There are 3 stations. Each one of them lasts 10 minutes with a 5-minute break between. So you have a clinical station consisting of 2 parts. Each part is a different case. A management station consisting again of 2 parts. The first part is about a speech you need to deliver, and the second part is about the management questions that are pretty normal in every other kind of interview process. Last but definitely not least is the portfolio station. It's 10 minutes. Theoretically, they can ask you all kind of questions like why surgery, why this, why that, but I will focus more on what they actually ask you about. In case any one of you is applying this year, I strongly encourage you to log in Oriel and HE and look into the updates there, updating daily, I believe, regarding the format of the interviews. The current plan is a half-hour interview that all parts are merged together, and your portfolio will be assessed upon your application. So for the clinical stations, you'll get two scenarios. The first one or the second one, depends, will be about trauma, whereas the other one will be about a peri-operative patient that becomes unstable or unwell, or a post-operative patient. So they want to see how you would assess a patient based on ALS or the care of the critically ill surgical patient protocols. This is a Royal College of Surgeons course. It's quite hard to do it before starting CT because there are very limited slots, but it follows the principles of ALS, and it's all about stabilizing and escalating an unwell patient. ATLS, it's about trauma. It's about safely managing a trauma patient and making sure they're being transferred to a trauma center, or they're being dealt with in a trauma center, depending on the context of the question at hand. Regarding the management stations, the first part, as I talked about, is about a known subject that you need to offer a 3-minute presentation. Every year they publish a slightly different question, but always the concept is about how you are a good leader and how your leadership skill will translate into something useful as a core surgical trainee. NHS is giving incremental amount of focus on how medical professionals and surgeons need to be leaders in their departments. And this is a kind of question that they're trying to screen and see that you understand what kind of leadership values you have and how this would translate in your day-to-day clinical practice. They follow up with 2-minute questions. And then the second part is all about the normal question that you would expect in every other specialty, some sort of ethical dilemmas and more surgically oriented questions about consent, about procedures that need to happen, but there might not be a slot, or there might be some problem with ITU and you need to improvise. There are specific tools and adjuncts like STAR or SPICE, and there is a lot of excellent material out there to practice. In all honesty, it's not easy to cover everything. I went there feeling myself fairly well prepared, but still the question they asked me, I had never prepared for it. But still, using this adjunct, I managed to go through. So it's very important to keep them in mind, and no matter what happens, keep calm and go through the structure that you have studied and learned. Regarding portfolio station, every year they issue a different self-assessment scoring, and every year it does have slight differences. So compared to last year, last year, if you had sit through MRCS part A or B, you were getting 2 points. This year, if you have sat it, or be that fail it or just sat it, you get 1 point. But if you have passed it, you get 3 points. So it's quite important when they publish an issue, the self-assessment, to read it very thoroughly, because it might not be the same as last year's. I will speed run through the sections that are effectively giving you points. One is your primary degree and postgraduate degrees. If you have a PhD or a master's, that's good for you. I happen to have a master's degree, but again, this is not really giving you that many points, so that gave me 2 points. So it's definitely not worth investing your time if you think about applying this year, next year, or you had already applied. Of course, doesn't apply. But these are some nice extra points if you already have it. but don't worry if you don't. Prices, there are a lot of surgical committees, and there might be some regional prices, some audit presentations, something like that going on, probably as a webinar nowadays. So if you manage to get your hands on a prize, that's perfect. Again, maximum points you can get out of this is like 4, so don't worry too much if you cannot get that. Quality improvement, that's probably the section that gives you the most points. For my interviews, it was like 11 points. And you need pretty much to do an audit, ideally, and not just a quality improvement project. Do a repeat cycle so that you have managed to improve something and contribute to quality improvement, and then present it regionally or nationally. ASIT or foundation school run a lot of kind of national presentation days, and these are ideal because they accept pretty much all this kind of audit presentations, and this is a valuable point for your portfolio. Training and teaching. In order to get the most points, you need a master's in teaching. Good job, well done if you have it. No point in starting undertaking one while being still in a pre-city situation. You can get a bit of extra points if you have undertaken some of the training the teachers, or GIC course if you are an instructor in ALS or something equivalent. Most points you will get by organizing teaching. So you can get points from organizing a couple of teaching sessions, for delivering a couple of teaching sessions, but the maximum points you will get if you organize a series of teachings. And pretty much your aim is to create a theme and deliver a spree, or cooperate with one of your colleagues to deliver a series of teachings on that specific kind of subject, and get someone to sign you that you organized a teaching program rather than a standalone series of teachings. So try to get a theme. Your target group can be anyone. So if you're in a teaching hospital, that's excellent, because medical students are always keen to learn, and it's easier to get hold compared to other doctors because of rota problems. Regarding presentations and publications are excellent if you have them. Again, it's probably late if you want to start for next year, because all the journals have huge delays due to COVID-19, but I wouldn't worry too much, because the points again are not that many. That being said, if you are thinking of starting F2 or something equivalent, and you have 2 years ahead of you, that's plenty of time to get something published. So I would encourage you to try to get your hands on some project, speak with your consultants. They always have something fancy that they would like to publish. Be very wary of what you pick, because there might be a good reason why it has not been published so far. But if you manage to get some publication, this is something that will get you ahead of the other candidates. Presentations, there are a lot of easy ways to do them. Again, as I said, ASIT is an ideal they run conferences of surgical interest, but also regional presentations are ideal to get some points in there. Leadership roles and procedural experience. So for leadership, you need to have some kind of role, and that is not limited in medicine. So if you had some sort of students committee that you were chairing, or that you were member of during your medical school, that applies. If you were like a captain of the football team or something equivalent, it is a leadership role, and you just need a letter just testifying that you had the said role. Regarding procedural experience, that's quite interesting, because last year it didn't matter whether it was surgical or non-surgical. So doing lumbar punctures or ascitic tap drains was procedural experience that was deemed valuable and was giving you points. This year, it's only surgical experience. So the way to do it is by getting a taster week, and while you are at the taster week, you will try and set up your e-logbook and get some procedures logged in. As I said earlier, having a surgical job gives you 0 points, but undertaking a surgical taster week gives you points because it's commitment to specialty. It's a little bit weird the way it functions, but pretty much if you said had like 2 years of working experience surgery, it contributes to nothing. But if you had undertaken a single week in a surgical specialty, it is considered commitment. So even if you are trust grade or in a non-training capacity, it doesn't matter. Speak with your supervisors. I know a lot of people who have done that. Most of the trusts are happy to accommodate 1 week placement in a specialty of your choice. And this is your precious surgical week that you will reflect upon and get all the bits of logbook, etc., done as you wish. If you are not currently working and you have the time and funds to spare, a surgical elective is excellent option to show some commitment to specialty, and it's also an opportunity for you to log in some procedures. But this is again something that if you have done as a medical student, it's great. If you haven't done, probably it's not worth taking time off work because there's no way to fund yourself doing that. Last but not least, craft courses or workshops in surgery are giving you points, and any sort of membership in surgical society gives you points. So something that's not very well known is that you can become an affiliate member of Royal College of Surgeons for about £26. Effectively, you are buying some points, and it shows commitment to specialty because you pretty much show your commitment to following the Royal College of Surgeons updates and so on. If there is any other surgical society or body that you are a member of, if you have an evidence, it's fine, and it gives you the points you need. Lastly, because as you can see, all these are a lot of points and a lot of different sections. They offer up to 3 points if you have a nice and easy to go through organization of your portfolio. Do not be intimidated. On my day of interviews, I remember there were people who had like leather-bound portfolios with their names engraved on them and things like that. All this is fancy, but it doesn't matter. Organization is all about how easy it is to go through. I had a pretty standard portfolio, both for like 15 quids, and it got me through the whole 3 points. So don't worry about that. That is the structure of the interviews, or at least in their traditional capacity. I hope it was helpful to understand a little bit what are the requirements for you. I appreciate we are a little bit tight on time. So instead of trying to go through further questions, further details, I would actually prefer to offer the floor back to the panel and let them ask me questions that you have been communicated to them, hoping that this is better addressing your problems or issues raised so far. Thank you very much for your attention, and I hope it was help. And if thank you.
Thank you, Dimitrios. That was really useful, short, succinct, to the point, and I think a lot of value in there. So we've had a couple of questions come through. If we can just get some quick answers to these. What's the cutoff score for self-assessment score to get a CST interview?
Yeah, that's tricky because they do not publish that.
Okay, so it's unknown. So
The honest answer is we do not know, because
Okay.
every year they offer a specific number of interview slots. So it depends on the cohort. If everyone is better than previous year cohorts, then the score is higher. So it really depends is the answer.
Okay. Brilliant. And that's same as a lot of specialties actually, not just surgery there. So that's important to know. Please tell us if IMGs have disadvantages applying for surgery or a lower chance to get into surgery as compared to UK citizens.
So, as I briefly mentioned at the beginning, what used to be the case was that because surgery was not in the reserve list of specialties, if you were an IMG, you would have to apply for round two, which means you had to pick through the leftovers. But since last year, they have actually removed that limitation, so you can definitely apply from round one. There are some small disadvantages that you can never actually get the points for. So, for instance, in the degree section, I mentioned the primary degree as well, and I did not develop that at all, because if you have like specific degrees from Oxford or a 6-year course in, I don't know, Imperial, you get more points. That being said, you get just 2 more extra points, which is fine. It's a very small kind of handicap, and it's definitely not something that should stop you from applying.
Okay. Great. Kindly shed some light on if I finish general surgery and super specialty back home in India, how should I apply it as an IMG in urology?
Mm. If you have completed general surgery, probably I would not recommend you going for core surgical training, but instead I would advise you to do the MRCS part A and B and apply for ST3 in urology right away.
That's really good
That
advice.
being said, if you still want to do, well, one limitation that core surgical training has that I omitted is that you cannot do the training program of core training if you have already done more than 18 months in the specialty post foundation school. So because you undertook your surgical training in India, it doesn't count as foundation school. By default, you have done more than that. So you cannot really apply for core surgical training. However, you are able to apply for ST3, so for a registrar kind of job, level job. And probably if you have no previous UK experience, the best thing you can do is get a trust grade or a junior clinical fellow or equivalent job in order to get experience on how NHS operates and works, and get your MRCS done and apply for an ST3 job in urology or whichever specialty interests you.
That's really useful. Just a couple of last quick questions, Dimitrios. How can we start our journey in research, especially if we don't have any experience in this area?
Yeah, so research is a little bit tricky because it depends on a small degree on luck. So if you have no previous experience, it's fine. The best thing you can do is identify someone who is undertaking research in your hospital and approach them. They always need help, and they always are keen to take someone who is interested in assisting them and getting their work published. That being said, if you are in a small DG8 hospital or where research might not be blooming, you might have better chance in trying to just do some publication by reviewing some works or doing a systematic review, which is a little bit trickier if you have never done it before, but the quality of your work would be better. all in all, try to identify, even if you are on a DG8, if there is anyone undertaking research. I was on Isle of Wight last year. There was some research on asthma. I did not delve into it because it was far off from my surgical interest. But if someone was into medicine or pediatrics, there was still opportunities for them to actually do something. So I would say speak with your supervisors first on the matter, especially if you don't have any experience before.
Brilliant, Dimitrios. There's lots and lots of questions coming in, so I'm just gonna divert them if that's okay to yourself,
Okay.
just to answer out of screen because there's so many coming through and we're not going to get through them all. So I'm just going to divert those across, and then if it's okay, we're going to move on. But Dimitrios, thank you so much. That was really useful, and a lot of people are looking forward to the surgical talk, and hopefully giving people a good jump start in terms of their application. So thank you so much for your time, and I'll send some questions away if that's okay.
Excellent. Thank you very much, everyone.
Perfect. Thank you. Right, that was really good. And now we're going to move on to another really popular topic of request, emergency medicine. Got